My name is Brian, and for most of my life I've had jobs where I do a lot of standing. I've worked in fast food, I've worked waiting tables, and I currently have an office job where I stand most of the day to attend clients. One of the things I've started noticing over the years is that my legs were feeling dead frequently. I often felt like my feet were in cinder blocks when I walked. When I exercised, I started to notice that I couldn't jog as fast as I normally did. Things like that. And then I also started to have a feeling of either deadness or tingling very frequently in my ankles, in my knees, and in my hips. Over a period of time, I started to notice this getting worse, especially the last 8 to 12 months. I didn't want to go out at night because it was too much trouble. I didn't want to stand any more than necessary because it was too much trouble. I started not wanting to exercise because it was just too much discomfort. Well, one day I was walking through a local shopping center and I happened to see an advertisement for a local imaging and vein therapy center that treats varicose veins. Over the last couple months, because I had started to notice minor blue varicose and spider veins inside my thighs, I thought, maybe that's me. I thought initially I was just going to consult with the doctor at the vein center for cosmetic purposes, because I was so accustomed to living with discomfort and pain over my adult life that it didn't occur to me that I might actually have a deeper problem than just a cosmetic one. So once I went ahead and consulted with the doctor, they did an ultrasound and spoke to me about what my symptoms were, and that what I was seeing with my spider veins and varicose veins were actually one symptom, which combined with the feeling of deadness, the pain in my legs, the tingling I felt in my ankles and my knees and stuff, all of that was indicative of a deeper problem, which was a vein disorder. Well, once I had a chance to sit down with the doctor and his staff and talk, they immediately put me at ease. They were funny, they were easygoing, they took all the time in the world to explain to me what they were going to be doing, what I was going to feel like, how long the recovery time was going to be, all that stuff. I felt like it was probably one of the single easiest things I've ever done in my life, and that's largely due to the fact that the doctor and the nurses and the techs were all so helpful and friendly and just made me feel like I was part of their family and they were going to treat me like a brother or like they would treat a sister. So they scheduled me for a couple days worth of very easy, minimally invasive, quick treatments. I was in and out in about 45 minutes each day, Monday, Tuesday, Wednesday. Took a couple of days to recover, and now I feel like $1 million. It's the first time in my adult life that I don't have any discomfort in my legs. It's the first time in my adult life where I feel like whether I'm standing or sitting, I don't need to constantly be stretching or moving in order to keep myself from getting stiff. And basically I feel like Dr. Furlong gave me a big part of my life back, and I'm really happy about that.